Hello, in today's lecture we will discuss about the muscle which is called platysma. You can see here in yellow, this is the platysma muscle. This is the muscle, cutaneous and superficial muscle of the neck, one of the muscle of the neck. We will discuss its superior attachment. Also, we will discuss inferior attachment, innervation, and main action. Let's start with the superior attachments. Superior means upper, so the superior attachment of platysma is inferior border of mandible, which is this bone, which is mandible, and its inferior border is its lower border. So inferior means lower border. So the main attachment of the platysma muscle is inferior border of the mandible. So superior attachment of the platysma is the inferior border of the mandible. Also, the skin and subcutaneous tissues of the lower face. What about the inferior attachment? Main attachment is fascia covering superior part of pectoralis major and deltoid muscle. This is the pectoralis major muscle, which we will discuss separately, and this is the deltoid muscle. So, what is the main inferior attachment of the platysma muscle? It is fascia covering superior parts, which means upper parts, of the pectoralis major muscle, which is this muscle, and deltoid muscle. So this is the main inferior attachment of platysma muscle. What is the innervation of platysma? Innervation is from cranial nerve 7th, which is facial nerve, specifically cervical branch of facial nerve is the innervation of the platysma muscle. What about the main action? Because it attaches to the lower part, lower face, its main action is that platysma draws corners of the mouth inferiorly, which means it draws corners of the mouth inferiorly, and also widens it as in expressions of sadness and fright. Also, it draws skin of neck superiorly, which means upward, when teeth are clenched. So this is two main action of platysma muscle. It draws corner of the mouth inferiorly and also widens it as in expressions of sadness and fright. Second action is that it draws skin of neck superiorly when teeth are clenched. So, we discussed about the superior attachments and inferior attachments and also innervation of platysma. So, what is the innervation of platysma? The cervical branch of facial nerve is the innervation of platysma. So, facial nerve is the 7th cranial nerve. What is the inferior attachment? It is fascia, which covers superior parts of two muscles. This is the deltoid muscle and pectoralis major muscle. And what is the superior attachment of platysma? It is inferior border of mandible, skin, and subcutaneous tissues of the lower face, and has two main actions. Draws corners of mouth inferiorly and draws skin of the neck superiorly. Thank you.